Okay, hi everyone. My name is Price. For those who don't know me, I'm a senior research associate here at the unit. I'm so glad that Gary made the time to come today and talk to us. So just to introduce Gary very briefly, and he can talk more about his background and his work. He's one of 3 UKRI Clean Air Champions, I think, in the country. You can tell us a bit more about what that means. But he works and provides leadership and coordination across the Clean Air program, and he works with the wider research and the stakeholder community. Gary's got a lot of interest, I think, in communication to the public and policy makers, and that really what sparked my interest a lot in what he writes about. He writes regularly for The Guardian as well, and I really hope you touched on that, because that is something I think a lot of us are interested in terms of communication with the media, and he's passionate about that communication. So without further ado, I'll hand it over. Thank you.
Thanks, Haneen. Hello, everyone, and thanks to the organisers for inviting me along today. I was going to talk about air pollution and health in the 21st century, about evidence, communication and action. And it occurred to me, having put this together, that a lot of the evidence I talk about is actually epidemiological evidence, and I'm not an epidemiologist, so I feel a little nervous presenting epidemiology in such a place. What do? Well, I'm at Imperial College, London. I've spent the last 30 years of my life measuring air pollution. So starting with the London Air Quality Network, and working with government, local authorities, the Environment Agency and others, really to measure air pollution. I think you could say where my research interest generally is in urban air pollution, how it is changing in response to policy, and then how it affects people's health. So for about the last 15 years, I've been hanging out with a lot of the epidemiologists at Imperial. We used to be at King's, and now we're part of one unit. So I've been connected to a lot of epidemiology projects but led very few. More recently, my job role's changed away from leading measurement programs for air pollution to become a clean air champion for a thing called the Clean Air Programme. This is funded by UKRI, the Met Office and government, and is a programme of £42.5 million worth of projects. So mostly research projects in the UK, but also research networks. And then we have other parts, for instance, with Innovate UK, that's trying to bring along innovations and industrial ingenuity to this problem as well. My role there, I suppose, is threefold. One, we work with all of the researchers, for which we have several hundred who are connected to our different projects, to try to connect them together. We try to make the programme more than the sum of its parts, and I know that's a cliche, but that is really what we're trying to do. And then we try to connect the programme to other work that goes on in the UK, so coming here today, for instance. And then also we try to connect all of that with different levels of government, if you like, that translation of evidence that is coming from our research projects into government policy. Well, it's certainly at least making it available to policymakers, yeah, in ways that they can then use. So in thinking about what to talk about here, Haneen talked to me about communication. My mind went back to a presentation that I gave back in February at a local church in my hometown. And it was mainly to a group of climate activists. And I said to them that in the air pollution arena, unlike what happens in climate, we don't really have a lot of activity from people who are, let's say, denialists, or people that are out there with deliberate mis and disinformation, trying to disrupt the process of evidence towards policy and action. And somehow the gods of irony looked down from above on me, and then that was it. From that, from about a month later, the world changed, especially that around the air pollution debate in London. You'll have heard about the ULEZ that the mayor has brought in, And also there was the Upfield by-election where the mayor's policies were seen as a wedge issue. And they are now, you know, the green policies, if you like, are being seen as a wedge issue as we run up to the next election. So for a wedge issue is you have this whole spectrum of voters and you try to drive a wedge in at one point to separate off those that may vote for you and those that won't, and really focus on those that should. Yeah. So what I said as part of this is I thought we would be quite immune to dis and misinformation because we've been building up an evidence base in the air pollution and health arena that spans back over 70 years. And I'll touch on some of this. So some of the stuff that we have is kind of like foundational knowledge that's been established for decades. And this should make us immune to these things. And I think I was just, the God's fire, and he just really laughed in my face, I think. So if I can get this to advance, there we go. So how much air pollution evidence is there out there? Maybe if I can take is it possible to move that top banner? Let's pop it down the bottom.
You can minimize it as well.
Yeah, we've all had a go at minimising that, and none of us manage. But anyway, so I'll move it round if it gets in the way. So the evidence of air pollution and health grows by the day. I went down PubMed, this was a little while ago, 9th of October when I last did this search. You can see the slides are available later. You can look at the search terms. And I just searched for air quality, air pollution and health. And I got back just over 61,000 papers since 1931. Not all of them will be saying air pollution is bad for health. There'll be all sorts of findings amongst that, as we know. But just to look at the weight of evidence in this area, but not only that, the pace that it has arisen. So in the last 30 years, and that 30 years is significant, and I'll just remember, park that in your head and I'll tell you why. But there's been 56,000 papers. And then if we look in the last decade, there's been just over nearly 38,000. So just over half of the evidence that we have on air pollution and health has arisen in the last decade. And I'll talk about this a little bit as we go through and put some markers in. But I think it's really hard for policymakers to keep up with this pace of arrival of evidence. And I'll put a couple of points, but really I think the way that government is framing air pollution policy is based on the science of the 20th century, the other 30-odd thousand papers, and not what we've known in the 21st century. And there's a real need for policymakers to catch up. Or more to the point, there's a real need for us that hold the evidence and understand that to be able to communicate it to the public, to be able to communicate it to policymakers, to help them make smarter and better policy. I'm having an advanced slides problem. Hey, there we go. So mostly what I talk about is the UK, but we really must remember that air pollution is a global health emergency. It's not just me saying this for hyperbole to make it sound interesting. That was a statement by the WHO a few years ago. And it is one of the leading risk factors for an early death globally. So this is health impact assessment, which you'll all be familiar with. If you're interested in these global issues, have a look at the State of Global Air reports. There's been another one since the latest is 2020, but go and have a look at them, and they really map air pollution in a global scale. Outdoor air pollution is estimated, or is in their reports, 4.9 million early deaths each year. But then I say that, and then just last week when I was putting this together, we had this in the BMJ that puts the number to be a couple of million higher because they're using a different dose response function. So same exposure, different dose response function. But I think we can be satisfied that, you know, the consensus figure is on a handful of million early deaths per year. Haneen said I write for The Guardian. I wrote a piece on Delhi and some particular issues that it has with the burning of plastics, because, you know, a lot of people burn their own rubbish in Delhi. and the picture desk for the paper was looking for something to illustrate this. And they used this bloke here who's cycling to work in Delhi. And straight away when I saw it, it reminded me of all the iconic photos, which I've got a few later, of the 1952 smog and these black and white images. But if you look carefully, this isn't actually in black and white. The world there is black and white. It's a colour photo. This is the circumstance that he is peddling in today. Air pollution impacts in the UK. There's been various estimates of the annual deaths attributable to air pollution in the UK, and we've got ranges from about 40-odd thousand to about 100,000. I think these ones at the bottom end are done very much with global exposure models, and I don't think they probably have the detail of the UK. So, I mean, I probably put in my view the estimates of UK HSA between 29 and 43,000 are likely to be about the most vigorous for the UK. I think that's fair. Those from the European Environment Agency are pretty good and similar as well. So there we are. We think we know all about this. We think we can describe this. And then, as I said, the world changed. I'm going to get my glasses so I can read this slide. The world changed in earlier on this year, and we've had the entry of people who have spent a long time in the climate debate, and also, I mean, you've probably come across many people through the COVID arena. I think you were talking earlier about communicating some of the risks and evidence around COVID. So these organisations have moved from climate to COVID into air pollution. And we have this report here from this hashtag together. We've been very active in Oxford, if you're aware of the low traffic neighbourhoods. Is there an air pollution crisis in UK cities? And their line is no, not really. Why is this? Well, historical data, you see, I thought this was one of our, we were sound because of this. Shows radical improvements in air pollution, so therefore, because it's got better, it can't be harmful. Mortality statistics, and you'll understand this a lot more than me, are not grounded in strong science evidence, and they're subject of scientific disagreement, and are underwhelming when seen at the level of the individual, which I'm sure is very much on, you know, kind of ecological fallacy. It's very much on the things that you understand. Then we move on. Activists, politicians, and some scientists, including scientific advisors, so I think that's me, have willfully exaggerated and misinterpreted mortality risk from air pollution and failed to communicate shortcomings in science and science debate to politicians and the public. And really, that is our job, to address those issues. And I think it's, you know, it's very important we speak out to do so. The people behind this are incredibly skilled at the things that they do in terms of, you know, mis and disinformation. This gentleman here called Ben Pyle, who's one of the main authors of this, has a wonderful thread out there on the internet about his attempt to obtain the data in the mayor's report. And it goes on about his complaints to the Information Commissioner's office and everything like that. In fact, all of the measurements are online through a government portal and through what we run at Imperial. You can go to the websites that we've set up at Imperial and you can access over 1 billion measurements of air pollution for London. So it's, you know, he's chasing round to find it. It is all publicly available, but that doesn't make such a good story. Some of us have found ourselves in the media. I have in the front page of the Telegraph because I reviewed the mayor's reports. And one of the ways, if you want to try to discredit the science behind a policy, one tactic to be able to do so is to discredit the person that reviewed it. I had the honour, you can't really see at the back, but that's my picture, on the front page of the Telegraph. And I had the, I don't want to repeat this, the position of going to my local newsagents and buying a copy of the Telegraph, not my usual read, and seeing the bloke scan it with a picture of myself on the front page, and he didn't notice, fortunately. So what do we have in the air pollution arena? We talk about all of these, we talk about Do I have to click on this to get it to advance? Yay, we talk about, you know, real sort of population level figures, but has anyone heard of Deborah? Yeah, there's some recognition around the room. So Deborah died in 2013. She was around 10 years old at the time, and she died of asthma. Which was part of a repeated pattern for which had been affecting her health for like a year or so. Asthma was put on her death certificate, but her mum has fought since that time an extremely dignified campaign to get recognition for what caused her daughter's death in terms of air pollution. The coroner's inquest was reopened in 2022, 23, and then there was a finding, and she becomes the first person to have air pollution, certainly within the UK and globally, on her death certificate as a consequence. And although we talk about it less, there is a sorry, I have a bit of trouble with a right hand mouse. Probably. No, it's fine.
You can there's a more button, so if you go there.
More, yeah. Go on.
Behind this thing. Yeah.
Oh, we were all trying to do that earlier and it didn't work. Fantastic. I don't know why it worked.
Every time someone comes back in, it pops back up.
Okay. Yeah. But what also happened is there's a far-reaching prevention of future deaths report, and we, you know, those of us in trying to talk about air pollution thought this was really something that is quite a significant step forward in conveying the evidence base and the need for action as well. Has anyone heard the disinformation that has been circulating around this? It's quite common within London, but I don't find it when I talk outside London, which is quite encouraging. It roughly goes by a number of people, let's say, in the fringe media, and it goes along the lines of the mayor, through his impact assessments, as well as chief medical officer and all of those other people, is lying to you about the impacts of air pollution, and that ULEZ is just a way of taking money out of you. And so it roughly goes, we wrote to ONS and asked them about how many people have died for air pollution. They say we did this under a freedom of information request, and this is a magic spell that causes the establishment, if you like, to have to tell you the truth. And they wrote back and they said one person has air pollution as a cause of death on their death certificate, and therefore this is proof, of course, that the mayor's figure of 4,000, the 29 to 43,000, the 4 million globally is just a lie. There's no evidence that can support air pollution action. At least that's the line that they take. And it's interesting just how much that has circulated around. Where are we to move on? I'll click.
Shows it forward.
Yeah. So a number of people have tried to kind of expose this misrepresentation. There was a nice article by Amelia Gentleman in The Guardian, and there's a respiratory physician in South London called Laura Jane Smith, who wrote a piece in the BMJ, and they're pointing out that it's causing confusion for the public, and is sort of under, it's giving, so it allows those people opposed to public health interventions, so things like the ULEZ is a public health intervention, to misuse the statistics on air pollution to minimise the problem behind it. So anytime a public body responds to a freedom of information request, unless it's really about a person, it logs the response in public. And you can go and look at the responses, and there's several of them that led to this piece of misinformation. And every one of them begins with one person has air pollution on their death certificate. It also continues into, it is unusual for wider contextual factors such as exposure to air pollution to be listed on a death certificate. And it may be more informative to look at the epidemiological studies from UKHSA and others So that is really not featured in the way that people portray this. So what does this foundational evidence in air pollution actually look like? And I thought I'm bringing mostly epidemiological things here. So if you'll forgive me, but this is the way that, you know, this is part of the foundational evidence that we have, and not all of you are air pollution epidemiologists. So I'm going to skirt through some of this. Today, 71 years ago, so last winter, marked the 70th anniversary of London's Great Smog, and I was reminded by someone sending me a message today that it actually started today. So today is 71st birthday, and London looked a bit like this. You're probably have all seen the Ministry of Health report from 1954 that shows this time series of smoke, which effectively is PM 2.5, and I can explain the reasons why they are pretty much the same thing then. Sulfur dioxide and daily deaths within London, and you can see the death rate leaps. And then interestingly as well, if you look what we had before and what we have at the end of the analysis period, it hasn't yet returned to the baseline, but that was their cutoff. They put the area underneath the curve, you know, that area there, at 4,000 additional deaths. Bel Air reviewed it and looked at this period over here and its long lag, which was in the first report attributed to influenza. Found no evidence of that, and they put it at about 12,000 people. This is the worst disaster to have struck London before COVID arose, worse than the cholera epidemics of the 1800s, for which you'll all have learned about in public health, with Snow and his hand pump, and far worse than the worst times of the Second World War. These people, these 12,000 people, have no memorial, and I think that's absolutely shocking. So if we look here, December the 9th, so what's today? 6th. We are almost 30 years since the 6 cities study. Has everyone heard of the 6 cities study? Yeah, some nods. So the 1952 smog taught us that these acute events killed people, and 6 cities study followed people in 6 cities over a course of 14 to 16 years. And yeah, so what they did is they followed them, and if you talk to some of the authors, they've got a great way about how they did this, and just every year, everyone was sent a postcard that said, "Are you dead yet?" And when they didn't reply, they sent out a researcher to investigate. So a great deal was known about them. Probability of survival, these are things that you'll all be familiar with, split over between the cities over time. So there's quite a differential that was detected after 14 to 16 years. They adjust for all the usual confounders, and then whatever's left, they plot against fine particles, so PM 2.5, and ended up with this really straight relationship, giving us a rate ratio here. And that told us and really changed things, because it said that the exposure that people are getting day in, day out over a period of a decade and a half is increasing their probability of death. There's quite a bit more detail in here that I won't go into, but this was foundational in that it changed policy completely. So we just don't move from, you know, just looking at smogs, but we moved to control everyday air pollution. So in the 20th century, we spent a long time setting limits for outdoor air pollution, but the science has moved on considerably. This one from Francesco Domenici's group in the US looked at 61 million Americans who receive Medicare, and I appreciate they're not necessarily representative of the whole population in the US. But they looked at a hazard ratio, so this was associated with mortality, and against a concentration of PM 2.5, and we've been setting limit values for acceptable air pollution. You see, there's absolutely no threshold, and this is one of the things that's yet to be incorporated. So the EU, when we were apart, has limit values of 20, so we're here. So 20 to 25, the US limit value, effectively limit value is 12. The WHO guideline was 10 and has just been revised down to 5. So what does this tell us? It tells us really that we shouldn't have policies that stop when air pollution is reaching a certain threshold that might be somewhere up here. And pretty much all of our policies are framed in that way, with a couple of exceptions. So what we need to be doing is driving people down this exposure track. And that's recognised to some degree in the WHO air quality guidelines. I think Canada is probably about the only country in the world that's fully incorporated this. And what it says is we don't just take action where air pollution is bad. They have things we need to keep clean areas clean. Yeah, so we're not just moving, let's say, industry from the more polluted areas into the clean ones. We're trying to drive down air pollution exposure everywhere. I've been involved in a few projects that we've done in London. This one looks at children's lung health. And I'll show the reason I've put this in a couple of slides' time, but it takes a long time to do these things, from inception to the publication of the paper. This took about a decade, and we went out to measure the lung function of kids in East London. And what we found was the kids growing up in East London, on average, were losing lung growth that amounted to about 50 the volume of 50 millilitres. So it's about the volume of 2 hen's eggs. And you can think about 9-year-old kids you might know from your family and think about the volume of 2 hen's eggs perhaps within their chest. And that was the average lung function loss. Whether it's actually clinically important to them, I don't know, but whether it will be clinically important to them when they reach their 70s and 80s and, influenza and pneumonia comes along. And it holds the thing, are we setting about, through the air pollution exposures that we have today, a legacy of harm that will stretch out over many decades? And I think that's an open question. There is a bit of good news. The PAMSI cohort in Sweden, they did this. These types of experiments have been done Europe, Sweden, London, and starting in Southern California. But they were able to show in Sweden that when air pollution improved, then children's lung growth returned to a normal rate. They didn't regain what they'd lost, but returned to a normal rate. I really like this one. This was a study on biobank, which you'll all know far better than me, I'm sure. There's about 500,000 people in biobank, isn't there? And this looked at the old people, which is quite distressing for me, because I think they determined old people as those being over about the age of 40, and those that were living with more than one chronic illness. And having done all the usual things that are done for epidemiological studies, they then plotted this as quartiles of exposure for PM 2.5, 10, of course, and NO2 against we have a rate ratio or a risk ratio, and you can see that we have these really distinct straight line relationships for PM 2.5 and NO2 with this burden of long-term chronic disease. I mean, it's one snapshot. It doesn't show causality. It doesn't show the development over time. But I think it points to different ways that we need to be thinking beyond mortality into this chronic long-term illness. You can reverse their stats and say, what's the chance of someone having multiple long-term illnesses if you're above a certain concentration threshold. The UK government set a threshold of 2040. It's going to take us some time to get to. For those living above it at the moment, there's a 20% chance, if you reverse these stats, of multiple long-term illness. What's also interesting is they clustered the illnesses that people had, because there's loads of long-term illnesses, and they found a lot of them were for things that haven't previously been associated with air pollution, including those of brain health, so depression, anxiety, and so forth. Did this report with the Royal College of Physicians as one of the co-authors, and we tried to look at the lifelong impact of air pollution. And what we really did was we pointed out points in life where there was evidence that air pollution was affecting people. I'm trying to update this to a more recent report, but there's everything from pregnancy and birth outcomes, so preterm birth, low weight for gestational age, those types of things, miscarriage. Then when kids are growing up, we have the lung growth one from earlier one, asthma, and then things to do with brain health in cognition, and mental health in adulthood. And then, of course, there's a lot of evidence appearing more recently to do with dementia and air pollution. So there's good evidence here that it's not just mortality. You know, a lot of the disease burden that we have is associated with air pollution. There's a report by Comey on the dementia one. There's another one in Biobank which I quite like, which was this one here, where they looked at they must have been adults, so 265,000 people at the start, and then which were free from any respiratory disease, and they tracked them over time to whether they developed asthma, COPD, or lung cancer, and then whether they went on to develop more than one disease or they just died. And they looked at the associations for each of these transition points and found the associations with air pollution exposure for all of them. So, you know, it's air pollution is clearly affecting people over, this was, I think, around a decade. Remember the 1952 smog? So there's a really nice study of the kids that were alive in 1952. I think there's some birth cohorts that give us information about them. And they looked at the kids that were under the age of 1. So they controlled this with the kids that were under the age of 1 in the consecutive years either side. And they also looked at kids in the other large cities of the UK, not in London, in 1952. And they found that the kids that were in London for the London smog had a 20% increased probability of self-reported asthma in childhood. And just on the edge of statistical significance, there was a 10% increase in adult asthma as well. So this kind of builds into this whole idea that exposure, it isn't just air pollution affects us at different points in life, is that the exposure and harm from air pollution at one point in life can affect us later on. And I think that's really where we need to be probing the science and asking the questions at the moment. There's a nice one done by Anna Hansel looking at a 1% sample of the census and tracking them over 40 odd years from census to census. And they find a probability of early mortality associated not just with the exposure that they had. This is from the last census they looked at, not just the contemporaneous exposure, but an exposure, in that case, going back to the 1970s. So expanding back about 40 years. So how are we going to do this? Well, that's up to you lot. You're the epidemiologists. I just do the exposure stuff. We could start studying people today in the cohorts that we have and wait 70 or 80 odd years to get these answers, or can we look backwards? And, you know, that's really a challenge for the people here. The UK's actually created an air pollution measurement network sometime around the First World War. So there's measurements that extend back in some cities to about the 1920s. This data was stored in a government laboratory in Greenwich, which then became Warren Springs, so moved up to Hertfordshire and was then privatised. And this privatised laboratory just, you know, nowhere has a library these days. So all of the records of this were gradually pulled away. I was contacted by a woman called Alison Loader, who worked there and realised what was in these data sets from this network from the 1920s to the 1960s. And she was working with 2 of these boxes underneath her desk and the other 2 hidden in a stationery cupboard. So they now are in the repository in the library at King's where we were. But is there an opportunity, and it's really one for your community, I think there is, to be able to mine these printed data, to be able to start to create time series, and we can look at contrast between UK cities maybe and how they changed and whether there's something that could be drawn from there. I had an air pollution PhD student, and we took a dive into this to see if we could extract. It needs one of these data rescue projects. You know, the way people are out there rescuing climate data from ship logs. So we need to do that, but we tried to extract some data from it. And we've got concentrations prevailing in UK cities, that's Stoke-on-Trent, for about 800 micrograms per cubic metre as an annual mean, which is about 4 times what the bloke cycling in India has. I mean, there's only 40 million people in the UK at the time. There's, what, 1 billion people in India. So the global burden's bigger today than it probably ever has been. But I think there's a huge opportunity to be able to do something there. This all sounds like doom and gloom. There is, of course, quite a set of studies that show how health changes when air pollution changes. I think the best one of these, well, some of them I've got 3 or 4 here. And I think these are really important in terms of the communication we put forward, rather than air pollution just sounds almost like an intractable problem. There is good evidence that if we improve air pollution, then health outcomes improve as well. And they're really important in order to be able to transfer, well, you know this all more than me, you know, what was measured as associations into something that, it's gone now. Who's the bloke who has his criteria that we all talk about? Bradford Hill, thank you very much. So, you know, if you look through his criteria, part of it is this reversibility idea. So this one is Dublin, a bloke called Clancy who started the indoor smoking bans. Was in the 1980s working at St James's Hospital, and he was given the task of figuring out why so many people were dying in hospital. They were coming in and dying, and he couldn't come up with an explanation for this. And he contacted the city council, who sent him the air pollution data, and he found associations between the in-hospital death rates and the outside air pollution. And the reason is because the older people in the room will remember the oil shocks of the 1970s. Part of the response by the Irish government was to move away from oil heating in people's homes back towards coal and peat. So they banned the worst types of solid fuel. This is black smoke, so think of it as being PM 2.5. That for working purposes, it is in this situation. This is the winter-summer variation they experienced. They banned the worst types of solid fuel, and then we had an entirely different machine. They found a 17% decrease in respiratory mortality immediately afterwards in the city. There's some interesting aspects to these studies, which I haven't got the time to go into. You can ask me afterwards, but you know, it's a really clear piece of evidence. I wrote about this one in The Guardian. This is really quite a modern one of a coking plant. So they make coke for steel making. It's been done in Pennsylvania. You can go and look it up because the slides will be available afterwards. And this steel plant closed, and there was an immediate 42% decrease in emergency visits for heart problems, and declines in the year afterwards. Their study was structured so that they also looked at another town that had a similar coking works that didn't close, and was continuous. And that's one of these lines here. And they looked at a community that had no coking works and what the change was. And here you can see their emergency room visits that they had in their pre-intervention time, a projection of where it was going on trend, and then what the actuality of what happened, and their 42% comes from that area there. But it's a really strong message that if we improve air pollution, do something about it, then it can bring about changes in people's health directly. I have to talk about the London low emission zone. There's a lot of, you know, does it work? All of these questions around it. It works astonishingly well. I've been measuring air pollution in London for 30 odd years. I've not seen anything like it. This piece of data here shows air pollution next to roads. I'll only talk about, this is the central London line. And this is the sort of flat conditions that prevailed in London for some time on nitrogen dioxide. This is just the extra air pollution you get close to roads on top of the background. TfL did this analysis, but I was asked to review it. One of the things I put into the review quite strongly was more work on a counterfactual. What would have happened if the policy had not been in place? And so for a counterfactual, the original low emission zone there's that little piece there. So for the counterfactual, what we used was the rate of change in outer London. It's not a perfect counterfactual, but it just means that you can't claim all of it. Anyway, so that's what our counterfactual would have followed. This is what actually happened in central London. Then, of course, somewhere about there, you reach the lockdown periods and COVID. Yeah, but you can see as we're coming back from that, we're still considerably less than our counterfactual. And I think that's quite important and shows it's just a dramatic change. London's air pollution next to roads in the centre is nothing like it was before. Do these things work? If you look at the press in London and the debate around it, you would think this was the only such scheme in the world. There's around 300 different types of low emission zone that operate mostly throughout Europe, some in the UK and other countries as well. There have been a number of studies that have been sort of just looked for changes in health. And Rosemary Chamberlain, who's at Imperial, reviewed these. So just some headlines. So 5 out of the 8 studies that looked for changes in heart and circulatory problems found changes. So there's different metrics used. So some use hospital admissions, some use deaths from heart attacks and strokes, some use blood pressure. And there's a whole list of these things. 2 out of the 5 studies that looked for breathing and lung problems found improvements. The rest did not find a clear result that was statistically significant. Yeah, so there's good evidence there. Wood burning, I've done a lot of work on wood burning. There's some nice studies here in cities in Australia where they've intervened to fit electric heaters in people's homes compared to places where they haven't. And these have been detected in mortality figures. But all of these are places where we've got huge changes in air pollution. You know, so it becomes a challenge of how do we look in more detail at the changes we can affect through more everyday policies. And one of the difficulties with particle pollution is it's composed of particles from all of these different, with different chemistry from different sources and with different physical properties as well. So I think that's one of the challenges also for the connection between the air pollution community and your community is how we begin to disentangle this. I had one go with a student and we tried to think about it differently. So most studies look at one pollutant at a time. But if you take a deep breath here, we're not just breathing nitrogen dioxide, nor we haven't for years, you know, or PM. So we tried to look at different types of mixture. So we did something, some sophisticated Bayesian thing that tried to cluster different types of days according to what type of pollution prevailed on that day, and then look at the associations with mostly it was the sort of daily deaths and hospital admissions. And what we found was that this cluster here, which was mostly our secondary pollutants, our sulfate and nitrate, was the one that had the greatest association with our endpoints. They were all respiratory ones. But can we go further in our policies? And you'll all be aware of this. Loads of you here do stuff to do with active travel, don't you? So I put in this slide here, which is a lovely one. You'll all be familiar with from Biobank about, you know, looking at people for the first 5 years of Biobank and looking at commuters, so people and the ways they travel to work and the health benefits of active travel. And that leads us into thinking what the ideal solution should be. You know, we don't want to just be debating electric versus petrol and diesel vehicles. If as part of that we can increase active travel, then, well, you can tackle air pollution, we can make a difference to our climate emergency. We can tackle urban noise that we don't talk about much, that really plagues the lives of so many people, as well as introducing additional exercise into people's daily lives. Some of the means to be able to do this, as Haneen, as you're part of, are you part of that? Yeah, there we are. There's you. I have to get my glasses on. This recent policy review, which was in the Lancet.
Lancet Respiratory.
Yep. Sorry, yeah, I can't remember which one. But anyway, just looks at the way we should perhaps be shaping our urban areas. You know, so city planners accept we have to have clean water, we have to have sewerage, even if we go and put it into the neighbouring river. But these are all part of city design. So should we be ensuring that we also have transport systems and urban space that promote good health? And to me, it's a no-brainer. But we've got things like 15-minute neighbourhoods, which have proved immensely controversial with many people on, I think, the far right, really. This is the French idea that you can go and buy yourself a baguette within 15 minutes walk. Sounds great to me. Personally, I like the idea of being able to waddle home from the pub late at night, you know, walking without having to travel too far. And then, of course, there's low traffic neighbourhoods. You'll be aware the Prime Minister announced a review of the evidence base on low traffic neighbourhoods. Fortunately, obviously, you didn't know there was one already underway, which was published a month or so ago, which looks at all of the traffic changes in low traffic neighbourhoods across all of London, and finds that the simple tropes of we're moving traffic from inside these low traffic neighbourhoods to the boundary roads is not so simple, put it that way, without going into the details. So COP's going on at the moment, and I think it's really important, thinking in a policy arena, that we need to ensure that the policies we have for air pollution are also, you know, or the policies we have for climate are also ones that benefit air pollution. And our track record here is pretty bad. Biomass and home wood burning, urban combined heat and power systems, dieselisation of the European vehicle fleet that we have been absolute disasters for air pollution and public health. And I think they really haven't done much for climate either. So we need to be thinking about this, you know, set of policies here. And I really shout out to my late colleague, Martin Williams, who first put this together, this way of thinking. He was out in King's, but also spent some time in government. I'd like to go further, and I'm really rubbish at graphics. So if anyone else wants to have a go at this, but you'll just have to come with me and imagine a third axis here, yeah, that's sticking out or going into the screen, whichever way you want to do it, which is health benefit. So we talked about, you know, diesel, petrol versus electric, or if we have active travel, and clearly that moves us along there. There's other ones, clearly, with the way in which we're going to heat our homes. If everybody just has a heat pump, well, that's perhaps one solution. But if we actually invest in people's homes so they're insulated and warm, and people can afford to heat them, then clearly that will have far greater impact on public health. And the heat pumps will be smaller. Lastly, you know, what do we want? Where do we want to live? And I think it's really worth asking this debate, you know, where are we going? And ideally, we should have low carbon, smog-free, socially inclusive, biodiverse, healthy cities, towns, and countryside. Since, you know, there's a lot of social things, towns and cities become divided by the major road that runs through them, for instance. So here's a number of places that we might like to live, and pretty much I subscribe to most of those. Remember at the start, I talked about giving a presentation in a church back in February. It's that one there, which is on sort of a shared space, actually. But all of these places exist. This provides, you know, but to do this, we're going to have to think about repurposing some of the space in our cities away from motorised transport to create areas where, I don't know, you can sit outside with your friends, where kids can play. I mean, look at this young lad on his space hopper. He's beaming from ear to ear to have the space outside his school to play and just be with his mates and to be his best self, really. So that's me. I finished before the time, so that's all right. So we've been talking about air pollution health in the 21st century. I hope I haven't done a too bad job of bringing some of the epidemiological evidence to one of the homes of epidemiology as a non-epidemiologist. As I say, check out the Clean Air programme for all the projects that we've got. And if you like, I've written a book which I think is about £8.36 in Waterstones now, because it's out in small paperback. And it should be in your library somewhere. So that's me. Thank you very much.